Today, we're talking about something truly revolutionary in pediatric medicine, and it's all inspired by the work of Dr. Claudia Gambín Garcia. We're looking at a model that flips the script and asks a really powerful question. What if, instead of bringing a sick child to the hospital, we could bring the hospital's most advanced care right into their own home?
I know, that might sound pretty extreme, right? But for a growing number of families, this isn't a hypothetical. It's their everyday life. And that reality, well, it's forcing the entire medical world to completely rethink how we deliver life-sustaining care, right from the very beginning.
All right, so let's get into it. To really understand why this new approach is such a game changer, we have to start by understanding who we're talking about. Who are these kids, and what is life actually like for them and their families every single day? Okay, so the official term you'll find in the research is complex chronic pediatric patient, or PCC. But, this is so much more than just a clinical label. It's a shorthand for a really specific, really demanding, and unbelievably challenging set of circumstances that shape every single aspect of a child's life.
And this is really the key. We're not talking about a single illness that has, a simple treatment plan. Think of it more like a super fragile ecosystem of interconnected needs. We're talking about a world where a ventilator is just as vital as a parent's hug, and where the threat of a sudden, life-threatening crisis is always there. And because of that constant threat, the local hospital ends up becoming a second home, and a much less comforting one at that. This whole cycle of crisis, hospitalization, crisis again, it can just completely take over a family's life, creating so much stress and disruption. And that really brings us to this crucial shift in thinking. The old way, the traditional model, it's totally reactive. You wait for a problem, then you rush to the hospital. But this new home care model, it's proactive. It's all about getting ahead of the problems and managing them in the one place that's most comfortable, their own home. So this all builds into a totally new way of looking at care. And we're not just talking about what's convenient here. This is about fundamentally changing the hospital's role in a patient's life. It stops being the center of all care and instead becomes a vital source of support for the care happening at home. And boom, this statement right here gets the absolute heart of it. It's about decentralizing that highly specialized medical care. The goal here is to empower families, to turn them into confident, capable, and immediate first responders for their own child. Okay, so what does this actually look like day to day? What does bringing the hospital home really mean? Well, the whole model is built on intensely training families so they can master 3 absolutely critical pillars of advanced care. First up is one of the most basic, most vital functions, breathing. For so many of these kids, simply making sure they can breathe safely 24/7 is the main challenge. And it takes skills that not too long ago you'd only find inside an ICU. A lot of the time, this means managing a tracheostomy. And as the research behind this model shows, taking care of this little device requires a level of technical skill and constant attention that used to be only for highly trained nurses and doctors. So parents and caregivers are literally trained to become experts. They learn how to clean the site, how to suction the airway, manage all the equipment, and maybe most importantly, how to respond calmly and correctly in an emergency. They basically become their child's personal respiratory therapists. All right, the second pillar is nutrition. Now, think about it. For a child whose body is already under a ton of stress, getting the right nutrition is everything. It's essential for their stability, for growth, for fighting off infections. But just like breathing, it can be super complex. And a lot of times, this is done through something called home enteral nutrition. And again, parents are the ones who are trained to manage the feeding tubes, operate the pumps, and make sure their child is getting the exact life-sustaining nutrition they need, all from their own kitchen. The final pillar is what ties it all together. This is about managing a whole cocktail of complex symptoms and medications, but doing it proactively. The number one goal is to stop crises before they even have a chance to start. And this approach is really all-encompassing. It's not just about treatment. It includes palliative care that focuses on comfort and quality of life. It can even mean using advanced techniques, like special injections to stop seizures right at home. This is what really shifts parents from being caregivers to being core, confident members of the clinical team. So you have all this technical training, all this intense medical management. What's the actual result of this huge shift? Well, it turns out it's about so much more than just being efficient or keeping kids out of the emergency room. And this quote right here just captures the whole philosophy perfectly. The medical stuff is just the tool. The real goal, the end game, is to give back that sense of normalcy, that feeling of safety, and that family life that a complex illness so often steals away. And the results are just profound. Of course, you have fewer expensive, stressful emergency hospitalizations. That's huge. But even more important, families feel empowered. The child actually has a better quality of life. And there's finally more time for the simple things, like just playing with their siblings. It's a huge shift from just trying to survive to actually truly living.
So all of this leaves us with a really powerful question to think about. As our technology gets better and better, and we're able to manage more complex conditions, could this compassionate, effective, and empowering model be the blueprint for the future of healthcare? Not just for these kids, but for all of us.